everyone. My name is Allie, and I'm an admissions assistant and professional relations specialist at Eating Disorder Center in Montana.
And I'm Rebecca, and I am a registered dietitian at EDCMT.
And we're going to dive into talking about the truth about struggling with food and bodies. Specifically the year 2020 has been hard on many levels for people, financially and health-wise, and specifically since COVID-19 has taken place, the National Eating Disorders Association helpline has increased by 41% since lockdown orders took effect. And so because of that, we're gonna even look into what warning signs look like, symptoms that come about, and health consequences of eating disorders. Here are some questions to consider as you analyze maybe for yourself or for someone that you're concerned about. Questions like, do you hate the idea of gaining weight? Or maybe, do you restrict food to avoid gaining weight? Or maybe, do you feel physically or emotionally bad or guilty after eating? These are just a few questions to ask, in looking for warning signs. Some other common warning signs and symptoms can be broken down from emotional and behavioral to physical. On the emotional and behavioral end, you may be socially withdrawn, or you may have certain food rituals, or you maybe even see extreme mood swings. Now, physically, some to mention, you might experience dizziness upon standing, or, you have issues with dental, skin, hair, and nail health. You may even have impaired immune system. So even to speak further into health consequences, it can look anywhere from having muscle loss or, having bloating or nausea, or you may have hormonal changes. All of these are consequences that can happen with eating disorders. And there are co-occurring conditions along with that. Many of those who struggle with eating disorders have a co-occurring condition, such as anxiety or substance abuse or obsessive compulsive disorder. Even along with that, this might sound scary and serious, and it definitely is. We're not here to pretend that it isn't, but it is also common, and it's also very treatable, and you're never alone in it. Like we've said, seeking treatment is available. You're not alone in that and finding help. Here is a testimony, actually, of a patient, a local patient, who talked about their survival through bulimia. They said, "I was convinced to my core I never would survive bulimia. I'm coming up on 1 year of no binging or purging, and it's been nothing short of a miracle. I look forward to my time with my therapist every week. I look forward to the safe place I have with them and the space they give me to heal." That's really awesome to hear from someone who has been through it and who has found healing. Going off of eating disorders being serious and life-threatening, and they are treatable. So eating disorders are not fads or phases. They have the highest mortality rate of any psychiatric disorder, and they have serious effects on health, productivity, and relationships. Early intervention increases likelihood of a full recovery. So that is important to note. Eating disorder treatment can look like intervention, professional treatment, ongoing support, and recovery. Eating disorder treatment and recovery involves intervention, professional treatment, ongoing support, early diagnosis and intervention significantly enhances recovery. And following intervention, professional treatment should be the first step. Eating disorders require the care of a trained professional with expertise in the treatment of eating disorders. Ongoing support from friends and family is vital. Although more research in the field of eating disorders is needed, various evidence-based treatment options are available. Here are some levels of care in finding treatment. There are inpatient programs, that would be the highest level of care. And then the step down would be residential, where you would have 24/7 care, and you would be, these patients are living in lodging and having care 24/7. And then the next step from residential is partial hospitalization or day treatment program, which we offer at Eating Disorder Center in Montana, as well as intensive outpatient and outpatient services. Another testimony from a local patient, they said, "This journey is incredibly scary and difficult, but I know that with my therapist and the other members of my care team, I will always be supported and cared for no matter what comes my way." So how do you know if you need help?
Yeah, let's dive a little bit into signs that you may need help with an eating disorder. Eating disorders and disordered eating are complex and multifaceted, and they're not binary, which means there's no such thing as sick or not sick, that clear line. This is about your lived experience, and if you are struggling with food and body, you may need help. And oftentimes with our patients, they struggle to believe that they're sick enough to receive treatment. So let's go over some of the signs that maybe help is what you need now, because there's no such thing as sick enough. You always deserve recovery. You always deserve to be heard and validated. In addition to that, it can be hard to know if you need help because disordered eating is very normalized in our culture, which we talked a little bit in our diet culture presentation. So things like denying hunger is really normalized in our culture. Same, also disordered but normalized is thinking that you shouldn't snack if you're hungry, or you shouldn't eat till noon, or that you have to lose weight. That's a belief that comes from our culture. We all struggle with bad body days. We all have ups and downs with food. And this is normal. It's part of being an imperfect yet still worthy human being. So again, how do you know if you need help? Here's a few signs. We have a lot listed here, and maybe a few of these might resonate. Some symptoms of an unhealthy relationship with food. Things like craving foods but not allowing yourself to eat them. Cutting out entire food groups like carbs or sugar or fat. Extreme clean eating. Feeling uncontrolled around food, out of control. Restricting food during the day and then binging at night. Or hiding food and keeping it a secret when you do eat. Not fueling after a workout or eating to recover from a workout. Feeling guilty or anxious if you eat something bad without exercising. And so many others listed here. We have even more on the next slide. More signs that you might have an unhealthy relationship with your body. Things like intense fear of gaining weight, constant body checking in mirrors, or pinching parts of your body that may have fat, disgust with your body. So many things. Avoiding social settings, feeling uncomfortable with eating, spending a lot of time on social media looking at food, health blogs, things like that. These can all be signs that there might be something out of sync in your relationship with food and body. Here are some check-ins. Thinking about that list, if you had time to go over and pause the video and read through them, what do you relate to on that list? How does that make you feel? Are there any other concerns about your relationship with food and body? Maybe take a minute to jot them down, think through it, be curious, and allow yourself to have some self-reflection. It's okay if you're still not sure after that, if you need help, and it's okay if you're not ready to get help. It's also okay if you just want to find a little bit more, do some research, talk to somebody, and see if help is right for you. But always, always remember that you are worthy of help. There's no such thing as not sick enough. And if you want help, you deserve it and you can get help. So let's talk about what help looks like.
You know, there are some stigmas around finding recovery. And so maybe you have heard of some of these myths and we want to bring truth to them. You know, there's no two people that will experience an eating disorder in the same way. And while there are some main foundations to treatment, it's going to look different for everyone. And so knowing these myths and knowing these truths are very important, maybe for yourself if you're needing recovery, or speaking into someone else's life that is seeking recovery. So what does getting help actually look like? Well, it looks like working with teams that specialize in eating disorders and that truly care about your recovery. It really looks nothing like the movies. Many people are drawn to this field. They have their own experiences. They get their patients, and they are trained to guide patients to address their stressors, you know, moving beyond disordered coping to free them to live wholeheartedly. And struggles with food and body is about food and body, and it's not. So what does treatment include? Treatment can include, you know, the nutritional counseling and therapy end, the individual and family psychotherapy. It also involves group therapy. Here at Eating Disorder Center Montana, we offer yoga, art, and music therapy. We also bring in the medical and psychiatric support. Now, treatment is not punishment. We really want to reiterate that as well to those that are seeking recovery. The goal is to empower our patients with, you know, newfound resiliency and skills they can use the rest of their lives. We are looking at wanting to see our patients live wholeheartedly. Care teams can include multidisciplinary clinicians, attending physicians like our psychiatrists, you know, advanced degree licensed therapists, registered dietitians like Rebecca, and registered nurses. Art, yoga, and music therapists are all people that are here and helping with your recovery. So taking the first step can be extremely difficult and hard and scary, but the goal is to make it as easy as possible. There are people like us to help you in that process, especially those beginning steps. So here's an example actually of, you know, making that first step and making that first call. Normally, a friendly and welcoming team member answers the phone. Someone like me or also at our center, Lori answers the phone. You know, most treatment centers have team members specifically designated to this role. The team member answers questions and listens to immediate concerns. The team member gathers information and sets up initial intake appointments with the care team. And then at the intake appointments, those include nutrition and therapeutic assessments. After the intake appointments happen, the staff recommends specific levels of care, and then someone like myself will reach out and connect with the patient or the family with those next steps based on the recommended level of care, and answers any questions from there. Now, community support. like us at Eating Disorder Center of Montana, we have a thoughtfully built home away from home. Ooh, I'm gonna go back here. We have a licensed healthcare facility. We are a licensed healthcare facility in Bozeman. And we refer out as well. We treat all ages and genders. We treat all types of eating disorders and offer evidence-based and holistic approach to care. And we treat not only eating disorder behaviors, but also the root cause. And then care options include outpatient, intensive outpatient, and partial hospitalization day treatment programs. And we do this together. Again, this is a testimony from a local patient. They said, I have a community of support, shoulders to cry on, and ears to listen to me when my mind is just snipping. I have hope poured into me through the smiles of my providers and other people ahead of me in the program. So again, there are support and resources. Here is that video that we referenced in the last presentation. You can click on this in the slide and go to NADA. They talk through, how to help a loved one, how to have that conversation, how to walk through it with them and help them find recovery and reaching out to programs like us. So how to help? There are do's and don'ts. Definitely be honest and vocal about your concerns. Be caring and firm. Suggest they seek help from a physician or a therapist. You're definitely going to want to suggest that they seek professional treatment. And again, remember your own boundaries and needs, because those are important too. Do not place shame, blame, or guilt on them. Give simple solutions. Don't give simple solutions. Don't invalidate their experience or try to convince. It definitely does need to be their choice, and we want to empower them in that way. Don't give advice about weight or exercise or appearance. And definitely don't ignore or avoid the situation until it is severe or life-threatening. What might this look like if you want to have this conversation?
Yeah, it's important to know that if you are not comfortable having these conversations, you don't have to. Maybe you're not comfortable confronting or addressing this with the person that you think is struggling. Maybe you need to confide in someone or get advice. But if you do feel comfortable having this conversation and it is something you want to do, ask that person for a specific time where the two of you can talk. Open up, tell them how they care to you, how important they are, and that you've noticed things that are concerning to you about what they're doing with food or exercise. Maybe just ask, open the door. Are they struggling with eating? And remind them that if they are, that is very common in our culture and nothing to be ashamed of. These conversations are difficult and the person might be upset or triggered, and that's okay. It's not your fault.
And again, support and resources are listed here that we recommend. NADA, again, you can reach out, you can text them. They have a 24/7 crisis support and a helpline. They have amazing screening tools that you can actually go to on their website. And then, of course, here, Eating Disorder Center Montana, you can call us during the weekday. And you can go to our website as well. You can follow us on social media. We share a lot on there educating around eating disorders as well. If you're needing financial support, Project Heal is an amazing program that we could also help coordinate you to. You can email them and they'll help you with any questions that you have regarding finances and seeking treatment. And then there also is a local help center that you can call or visit bozemanhelpcenter.org. And if you have any questions, please reach out to your teacher. Please reach out to us as well. We're here to help. And like we've mentioned before, NADA as well has a 24/7 helpline. Remember, healing is absolutely possible and not something we have to do alone. Thank you so much for joining us. And again, if you need to reach out, please do.
Thank you.
Thank you.